There's less chance of hypothesizing or hallucinating. That's a common error of large language models. So that is very critical, and that's why I'm very happy for an entity like EverMe that is building everything on the health for consumers.
Potentially have for the health and wellness industry?
Well, I think we all are privileged truly to be living in this era. So the amount of progress that AI is putting to everything, I think it would be mentally and more impactful in the health sector. And especially AI has multiple products to push the health into a future that kind of maybe feels like sci-fi. So having a technology like EverMe that tries to educate and empower people on their own health and style and learn from their own lifestyle to see, what's your priority, how you can improve your own. That is something that not a traditional medicine was built.
You can feel trusted in the information they're receiving.
That is crucial. The moment that you receive one misguided recommendation, because you're dealing with your own health, that is something that you cannot fix. Relying on wrong information or going to the wrong source for getting the information. And when a general large language model is built, or the way that they are built, they have different purpose. Some of them, they have marketing, some of them purposes behind, some of them are good for creatives, but the goal for health is different. You have to aim for 100 accuracy. You cannot lose on the safety. That's why it is critical for entities like EverMe to work on that, to build that trust and go maybe spend more time, more money to build a model that, even if it's less efficient, I don't know that, but it's more trustworthy.
Can impact personalization and wellness.
Well, the personalization is the ideal state that we could reach. And I don't think we've ever been close to that state in history. And that's the part that excites me. The reason is, in the current paradigm of doing clinical trial, but there are shortcomings of that paradigm, because what if I don't have necessarily headache, I have shoulder ache, then you have to design a separate trial. So that's why we have different type of research that covers that, which is called real world evidence. That's why the whole concept of normal test results versus optimal. What is the optimal or ideal test results or intervention that I need to make, not compared to the general population, but for my own cells, for my own lifestyle? What is that step that I need to take? And that is where AI, with all these features, are able to help us with.